Welcome back to Med School Radio. This is Simon coming to you from Tokyo, and we're starting off with a song from Naked Eyes, Promises, Promises, a song from the 80s. Anyway, let's get right to it. Today we're going to be looking at MCQs, 4 MCQs on pancreatic carcinoma. So let's start. A 50-year-old Jewish man comes to the clinic because of pain, back pain that has been worsening for about a week. He says that he has recently noticed small, painful bumps around his body and slight ankle swelling, but these symptoms come and go and do not bother him much. He does not smoke or use illicit drugs. He says that he has a few drinks sometimes on weekends with his friends. Which of the following is the most likely location of the cause of the patient's symptom? Okay, A, antrum of the stomach. B, centrilobular region of the liver. C, extrahepatic bile ducts. Or D, fundus of the gallbladder. One more choice is E, head of the pancreas. And the answer is head of the pancreas. Pancreatic carcinoma is commonly found in the head of the pancreas and presents with pain that radiates to the back between the shoulder blades, migratory thrombophlebitis, and general malaise, and typically presents in older Jewish and African males. Other major risk factors include smoking, diabetes, and chronic pancreatitis. So if you go into osmosis, you're going to be able to read some more details about this question. In the main explanation, for example, it says that pancreatic carcinoma is one of the top 5 leading causes of cancer deaths in the United States, and it has a very high mortality rate. Here it says approximately 1 year from diagnosis. I've seen other areas that say 5 years, 6 months, so it depends what you're looking at, and depends on, of course, when it's found. So things you might see, other symptoms might include general malaise, weight loss, weakness, Courvoisier's sign of a palpable, non-tender gallbladder, migratory thrombophlebitis, which is the Trousseau syndrome, from procoagulants and platelet aggregating factors secreted by the tumor. So if you want to see some more of the information regarding the main explanation, go to osmosis.org. Let's go to the next question. A 55-year-old man comes to the office because of yellowing of the skin. Ultrasonography demonstrates a 5-centimeter or 2-inch mass in the head of the pancreas. Endoscopic retrograde cholangiopancreatography with sampling shows cells with large hyperchromatic nuclei and a high nuclear to cytoplasmic ratio. And chromatogranin A staining is negative. Which of the following histologic features is most likely to be found in the tumor biopsy? A, acinar dysplasia with cellular infiltrate. B, ballooning degeneration with Mallory bodies. C, disorganized glandular structure with perineural invasion. Or D, islet cell hyperplasia with prominent rosettes. And E, saponification and fat necrosis. And so the answer here is C, disorganized glandular structure with perineural invasion. So the main takeaway here is that pancreatic ductal adenocarcinoma is the most common type of pancreatic malignancy. It derives from ductal epithelia and is characterized histologically by disorganized glandular structure with mucin production and perineural invasion. So again, to see the longer explanation, go to osmosis.org, where they will give some more examples and also a very nice histology slide. Next question. A 71-year-old comes to the office because her friends have noticed a slight yellowing of her skin over the past month. She says she has had persistent itching all over, had a recent weight loss of 6.8 kilograms, and a mild pain in the middle of her back after she eats a meal. On physical exam, there is a round cystic mass in the upper abdomen that is non-tender to palpation. Which of the following specific serum markers is most likely to be abnormally elevated? A, alpha-fetoprotein. B, beta-human chorionic gonadotropin. C, CA19.9. D, CA125. Or E, carcinoembryonic antigen, or CEA. And the answer is C, CA19-9. The major takeaway here is that CA19-9 is a tumor marker for exocrine pancreatic cancer, which can be suspected when a patient is characterized by jaundice and an enlarged non-tender gallbladder. So let's talk about the main explanation here just as an example. Patients with cancer of the exocrine pancreas are typically characterized by epigastric pain, jaundice, and weight loss. Jaundice develops when the mass is at the head of the pancreas and blocks the common bile duct, leading to hyperbilirubinemia. Bile salts accumulate in the dermis, causing marked pruritus, and the gallbladder may become distended and palpable on physical examination, also known as Courvoisier's sign. But it remains non-tender, unlike in cholecystitis. CA19-9 is a tumor marker closely associated with pancreatic cancer, and its sensitivity correlates with the tumor size. So remember that elevated CA19-9 is associated with biliary malignancies and hepatocellular cancer and acute cholangitis. For example, it has a low specificity. CA19.9 is used to monitor disease activity, and its levels are associated with long-term prognosis. Okay, let's go to the last question. A 55-year-old man comes to the office because of upper back pain for a month. He has lost 18 kilograms over the last 3 months. He has a history of hypertension and chronic lower back pain secondary to construction accident 20 years prior. His current medications include isinopril and hydrocodone, and physical examination shows scleral icterus. Laboratory analysis shows elevated carcinoembryonic antigen and CA19.9. 19-9. A CT scan is obtained and shows a mass contained in the head of the pancreas, and the patient is referred to the surgeon for a Whipple procedure. Which of the following organs are removed in this procedure? We have the choices here. A, entire pancreas, common bile duct, stomach, duodenum, jejunum, and appendix. B, entire pancreas, gallbladder, proximal ileum, and left hepatic lobe. C, the head of the pancreas, duodenum, proximal jejunum, gallbladder, common bile duct, and distal stomach. And D, head of the pancreas, gallbladder, and common bile duct. And the last choice here is head of the pancreas, proximal jejunum, duodenum, and common bile duct. And the answer is C, head of the pancreas, duodenum, proximal jejunum, gallbladder, common bile duct, and distal stomach. So let's look at the major takeaway here. The Whipple procedure is the removal of the head of the pancreas, duodenum, proximal jejunum, gallbladder, common bile duct, and distal stomach. And the main explanation, pancreatic cancer is very aggressive and has a poor 5-year survival rate. Here we have another survival rate, another difference here. If found early, surgical treatment can be attempted. The Whipple procedure is used for tumors located in the head of the pancreas and is the removal of the head of the pancreas, duodenum, proximal jejunum, gallbladder, common bile duct, and distal stomach, in an attempt to remove as many of the rapidly spreading tumor cells as possible. The reasoning behind the removal of a large number of organs is their common blood supply. A modified version is a pylorus preserving pancreatoduodenectomy, and preservation of the pylorus decreases the incidence of post-operative dumping and bile reflex gastritis. So that is the end of our 4 questions here. Thank you for tuning in, and to finish up, let's listen to the end of Naked Eyes. Okay, thank you for tuning in today at MedScore Radio. Remember, sometimes we go live on Instagram, and we are now live on Instagram, and the Instagram address is med_school_radio. Thanks very much for tuning in, and we'll see you next time. I'm going to stop the broadcast.